Hello, I'm Dr. Michelle Halyard. I've been coming to you over the past couple of weeks as a member of Alpha Kappa Alpha Sorority, Delta Beta Omega Chapter Breast Cancer Subcommittee member, and is also a practicing radiation oncologist at Mayo Clinic who deals with breast cancer patients. October is Breast Cancer Awareness Month, and our subcommittee has been bringing to you important messages about signs and symptoms of breast cancer, what to do if you need a mammogram and what a mammogram is like. And today we're going to be talking to you about an important topic about what to do if you're actually diagnosed with breast cancer. For people who are newly diagnosed, it can be an overwhelming time, one filled with many questions, anxiety, depression. For some people, none of that happens and they just take it in stride. But whatever your reaction to a breast cancer diagnosis is, it is your reaction and it is okay. There is going to be need to navigate the healthcare system, including tests and doctor's appointments, insurance questions, the balance of family and work responsibilities. And all of these can sometimes, again, feel overwhelming. It's important to know that it is okay to ask for help. We all sometimes, or many of us, try to act as superwoman and say, I don't need any help. I don't need to lean on anybody. But this is a time where you're going to need to be gathering a lot of information. And so it is okay to ask for help. If you are unsure of what to ask people to do, here's some questions that you might want to think about. One is, who would you like to talk with about your treatment decision? Who would you like to even talk with about your diagnosis? Who might you like to have with you when you go to appointments? Who can help you with practical support, such as figuring out work leave, meals, family care, driving, or the cost of your therapies or your medications or whatever is coming up? And who can help serve as a point person to keep others updated? Because a lot of times many people are asking questions. Your healthcare team, including doctors and nurses, social workers, and others, can be a great resource for you for social, emotional, and practical support. So here are some of the thoughts that I have if you're diagnosed with breast cancer. First and foremost, become an active member of your healthcare team. Ask questions and keep asking until you understand the answers. Communicate with your team. Tell them what you want them to know about yourself. Learn about your disease. Write it down in a notebook. You can record your interaction with your healthcare provider if they allow you to, and they really should. I don't think many people have a problem if you say, I just need some time to go back and listen, so can I record it? And also consider bringing someone along for a second set of ears. Find the right healthcare team for you. It's important that you trust the people that are taking care of you. And if you don't, switch. Learn about your treatment options and choose the right treatment for you. So what are some of the other specific questions that you should ask if you're diagnosed with breast cancer? So ask, what's the exact name of your cancer? Not all breast cancers are the same. Understand the stage of the disease or how far advanced it is. Understand, are there anything else that should be performed, such as cancer biomarkers or genetic testing that could help guide your treatment decisions? Understand what kinds of tests or procedures are anticipated for you. And when it comes to your breast cancer team, there may be many people involved, so it's important to understand what each of them do. For example, you'll likely meet a surgeon who will operate on your breast. You may meet a medical oncologist who will talk about chemotherapy or hormone blocker therapy if it's indicated with your type or stage of disease. And you may reach out and understand that you are going to need radiotherapy. And so you might see a radiation oncologist, such as myself, if X-ray therapy is needed. As treatments are described, you really do need to understand your different treatment options, the goal of the treatment, the expected benefits and side effects, how frequently and for how long this treatment's going to be given, and how will success be defined for each treatment. Remember to ask questions and keep asking till you understand. Some people choose to get a second or third opinion at another center or with another doctor, and that's okay. Be wary of the internet and look only at trustworthy sources of information. And we'll be talking about some of those resources in our next session next week. And lastly, ask if there might be a clinical trial that is appropriate for you. Often clinical trials or studies are great ways of getting cutting-edge therapies that can enhance your cancer care. And there are a tremendous number of safeguards that are put in place to protect patients undergoing clinical trials. So to recap, if you're diagnosed with breast cancer, it's okay to be overwhelmed. It's okay not to be. Remember, your response is your response. Ask for help for friends and family and the healthcare providers if you feel that you may need it. Ask many questions until you understand what you're being told to do, what you're being asked to do, what treatment recommendations there are for you. And find a healthcare team that you have faith in. And lastly, ask about whether a clinical trial might be right for you. So please join us for next week's session as we discuss further resources for you or your loved ones if you're diagnosed with breast cancer. And also remember, check out our postings about breast cancer signs and symptoms and also mammography. Thanks for joining. Hope this was helpful.